If you're a parent of a child with neurodiverse challenges, these are the two most important questions that your child's doctors and providers should be asking and probably haven't. Now, something real quick to note is that behaviors and challenges in themselves aren't bad. There's no bad behaviors. There's no bad challenges. There's no bad kids. Behaviors are simply a window into how a child's brain is functioning. Whenever we work with a child whose parent comes to us with behavioral challenges, with sensory issues, you name it, anything in this alphabet soup type autism, ADHD, OCD, ODD, you name it type issues, our job as a provider is to ask and answer two extremely important questions. Number one is the most important question anybody can ask, and that is asking, how is this child's brain receiving information from the environment? It's just that simple. Our brain isn't fully developed at birth. It grows and develops based off of the input that it receives. As we grow and we can move more, see more, interact with more, we get more and more and more input up to the brain. What can happen from physical, chemical, and emotional stressors, especially going all the way back to childbirth and birth trauma, which is the most common time that we see this happening, is that there can be neurostructural shifts of the spine, spinal cord, and nervous system that can cause an imbalance of information that reaches the brain. But the imbalance of information can result in a fight or flight response. I want you to think of it like this, right? If you've ever been to a chiropractor before, maybe you've had this subluxation or misalignment of the neck, and it's caused you to feel like you're holding your stress here on the neck. Now, feeling like you hold your stress there, that's actually what's happening. Your body's kind of holding on to that, and it's really going to impact your day. It's going to impact your focus. It's going to impact how you interact with your loved ones around you. But you're an adult. So while your brain is changing based off of the input that it gets, it's not fully developing. That same stress response happening during a time when they're literally laying down the pathways of how they're going to socialize, interact, engage, learn in their world for the rest of their lives, that fight or flight response isn't just going to become in the short term, it's going to start to actually change how their brain perceives the world. So of course, the number one thing that we want to do is analyze to see, is our child stuck in this neurostructural fight or flight state? Because that's the first thing we have to correct before doing any other work. But the second question is starting to look at what tools our child is using to socialize, to engage, and learn in their world. And these tools are really important because as we grow and develop, we should develop more complex tools. So let's put it like this. Infants interact with the world very differently than older children or than adults, right? Infants primarily interact with the world through what's called primitive reflexes. If I put a breast or a bottle in a baby's face, they're going to turn to look for that, right? They're going to turn to try to eat that food, eat the bottle, suck on the breast. They're going to do that and they have no control over it. Now, your child as an infant had neurological reflexes ingrained in their nervous system for their own survival and as a precursor to many of their levels of development. So for example, if you take a 3-month-old, a 4-month-old, and you swipe their back from here to here, they're going to uncontrollably contract to the side like this. Now, that's actually a good thing at 3 months old because that's what they need to later be able to learn to roll over and then eventually to crawl. You may have seen your baby kind of sleeping like this in a fencer pose. Again, that's the asymmetric tonic neck reflex. The reason that you might have swaddled your baby at night, and this isn't a conversation about whether or not that's right? The reason you may have swaddled your baby at night is because otherwise they would go like this and wake themselves up, which is a moral reflex. All of these reflexes were ingrained in their nervous system for survival. And almost every single reflex should integrate or essentially disappear by about the end of the first year of life. Now, your doctor, your pediatrician probably assessed to make sure that these reflexes were present, especially if you had any kind of breastfeeding challenge or anything else like that during the first couple months of life. But nobody ever checked, most likely, to make sure these reflexes had actually disappeared. Now, these reflexes didn't just disappear for no reason. The reason they disappear is to allow for higher levels of development. See, in the same way behaviorally or challenge-wise, right, kids never grow out of something. If you've ever been told that, you've probably noticed as a parent, they always grow into something else. Well, every part of their development happens for a reason. And after these primitive reflexes integrate in the same way that we had the spinal galant reflex, which I told you is the neurological precursor that causes them to be able to learn how to roll over, by about the 1 to 2 to 3 years of age, we're no longer using our primitive reflexes as the primary tool that we're using to interact with our world. we're moving into this realm that we call movement and touch. Now, this one's really important for me because at the time of this video, I have two children. I have a almost 3.5-year-old and I have a 2-year-old. And my 2-year-old, when he walks into a room, which he does, he walks, right? He absolutely wants to touch everything. He moves around, he touches everything. In fact, the primary way that he engages and learns with his world is by touching things. I want to see how they move. I want to move my body in space. And at 2 years old, that's absolutely how he should be processing the world. If I have a 6-year-old that comes into a room, and you may have noticed this, maybe with somebody else's child or your own child, and that 6-year-old comes in and starts touching everything, moving everywhere, pushing the chairs, touching everything, you're like, what's going on with this kiddo, right? But at 2 years old, that exact same behavior was totally appropriate. Well, why? Because the demands of the world for a 2-year-old are expecting them to be in this movement and touch realm. Okay? Very important. Now, again, that is the primary way that we engage with our world at this age, and eventually it gives way to what we call auditory and verbal processing. Really important for me as well with my 3.5-year-old, because this dude never stops talking. He's constantly talking, he's constantly listening, he wants to hear sounds, and that's the primary way that he engages with his world, right? We may refer to this as expressive or receptive language. That's the primary way that he engages with his world. Now, from here, what's really important is that when we get to this 5 to 6 years old, we move into the most complex area of the brain function, which is our visual and cognitive piece. Now, this is really important because this isn't just being able to process things visually. And if you think about for a 6-year-old, the demands of the world kind of are very visual for them, right? They start to get to the place where they have to sit longer in school. They have to process things from the board. They have to sit and listen and see things and start to read, and all these different challenges again at this age, right? And this visual cognitive piece is that when you enter a room, you're no longer touching everything. You're no longer exploring the sounds to that level, but rather what you're doing is you're using your brain to be able to process and scan. Now, I have a whiteboard behind me. None of you watching this video has to go up and physically touch this whiteboard to understand what it feels like, because you can visualize that. If I were to ask you to spell the word elephant, you're going to actually think about those letters in your brain. And that's what you should be doing, because we should be using this visual and cognitive piece. But for a child, let's say, who's had that neurostructural shift, had this subluxation, and deflected off of the normal path of development, and is stuck maybe here using these reflexes to be able to interact with the world, if the demands of their world are here, it's going to cause us to drop down and to deflect and to go deep on earlier pathways. And for you as a parent, what this is going to look like is a behavior. But remember, the behavior isn't bad. The behavior is a window into how a brain is functioning. So I want you to pay attention when you're seeing these behaviors in your child. I want you to look at A, what are the triggers? Are they visual triggers? Are they social triggers? Because socialization is a visual dance. I have to be able to predict the unknown. Anytime I am predicting the unknown, anytime I'm using things like the concepts of future and past, I'm not going to eat ice cream today, I'm going to get ice cream Saturday, if that's a trigger. If going and doing new things are a trigger, those are all very visual triggers. If sounds are triggers, right, we're going to go to auditory verbal. If being forced to stay still is a trigger, we're going to be looking to movement touch as a trigger. I want you to pay attention to what are the demands of the world that are overstressing our child. And I also want you to pay attention to how they react. Are they extremely emotional? Because that's what we've been talking with the part of the brain associated with primitive reflexes. Do they have motor tics or verbal tics? Is that where they're going when their nervous system is under stress? Are they constantly moving, and when they get stressed, they have to move around? We're seeing movement touch deflections, right? I want you to pay attention. What are the triggers and how does your body respond? See, as a provider, our job is to ask and answer two very important questions. Number one, is their brain properly receiving input from the environment, or is there some kind of subluxation in the spine and nervous system that is causing this input from the world to reach the brain unevenly and cause a fight or flight response, which is the underlying cause, the thing that nobody looked at that's going to result in the deflection off of this path to begin with. Then once we understand that and begin to correct that, we can start to look at how our child is processing the world. And we can take this beyond the theoretical of, oh, we're starting to look and ask questions in terms of what are they doing, what are their triggers, what are their behaviors, but we can actually go ahead and test this as well. Okay, we can look at things like, for their primitive reflexes, are these primitive reflexes fully integrated or are they still active? Okay, any child above the age of 1 that has active primitive reflexes is a pretty clear indication that something is deflecting off of the path of typical development, because they shouldn't be there. It means that when your child's under stress, they're reverting back to that part of the brain that's just simply there for survival, like when they were a baby, right? What we can also assess is looking at things like their gross motor and their fine motor movement. Remember, this is the order that the brain develops, right? You've probably had people look at and maybe even begin to do physical therapy, occupational therapy in this realm. But it's not just doing the things, it's the order that is important. We can assess the auditory, verbal, or expressive and receptive language. And we can also look at the ocular motor control as well, looking to see how the eyes converge, looking to see if there's any sort of fight or flight response when the eyes are trying to focus on something. And we can get a really good idea of exactly what's going on with our child, with how our child is processing the world. And because of that, what we can start to do is plan and start to A, get their nervous system out of a fight or flight response, and 2, B, begin to bring in brain-based games and exercises to actually be able to help them develop more complex tools, and then C, be able to give you as a parent right now strategies of what you can do to be able to meet them where they're at, decrease stressors and demands, and help them to temporarily use the tools that their brain is using to be able to process the world as we make this change so we can decrease their stress and let them grow and develop. Again, these 2 questions are the questions that every provider should be asking. And you've probably had people ask pieces of this, but putting it all together is how we can get to the root cause of some of these behavioral challenges and recognize that there's no bad kids. Behavior is only a window to the brain. The question is, what are we going to do about what we learned? Now, this is a really good introduction into how the brain actually develops. And what we've broken down is 8 developmental hierarchies. Okay, this is developmental hierarchy number 1, which we call the watch and wonder, looking and understanding how our child processes the world. And this is the clinical assessment, which is hierarchy 2. In these different hierarchies, we explore and learn about how our child's brain develops to allow them to be able to understand the concepts of future and past, be able to go from understanding gestures to be able to reading and writing. And in this series, we're going to break down each of these different hierarchies. So click down below to dive deep into our 3rd hierarchy, which is called our self-awareness hierarchy, where we'll explore how our child learns to just go from only thinking about themselves to be able to process and understand others, to facial awareness, to emotion, and what we can do to help them along. I'll see you guys there.